Good evening, and welcome to Keep Informed 24/7, your local news outlet for all news in your area 24/7. I'll be your host, Kenzie Nugget. Today, we have a shocking story about a rare condition called pseudobulbar effect, also known as PBA. Recently, we have received word about a severe local case from a University of Maryland student named Scarlett Vanilla, who hit her head after an unfortunate gardening accident. We will now play the security footage from the incident. Warning, this content is graphic and may be disturbing to some viewers. Finally done with today's work. Time to go home. Clunk! How unfortunate. We're now joined by our patient's roommate, Lola Salmon. Hello, Lola. How are you today?
Good, how are you?
I'm good. Now, Lola, would you mind telling us a little bit about your roommate?
Sure. Scarlett's pretty cool. She's my best friend. Recently, though, she's been acting kind of weird. Ever since she hit her head, she's suddenly been laughing and crying a lot. It's really awkward.
Wow, how unusual. Let's take a look at some of those instances. Keeping reptiles and amphibians as pets.
This is a book about reptiles and amphibians.
I just don't know why, but I just feel sad. I don't... It's a dead body. What is this? This is not what I got. What is this? It's all eaten anyway. It's all eaten. We will now talk to Scarlett's doctor, Dr. Ariana Hummus, for more information on the condition. Good evening, Dr. Hummus. Now, can you tell us a little bit more about PBA, how one gets it, and what it has to do with Scarlett's unfortunate incident?
Good evening, Ms. Nugget. PBA is a condition that can be caused by an underlying health condition or severe brain injury, such as stroke, a brain tumor, or trauma to the head. For Scarlett, her PBA was caused by the trauma to her head after it was impacted. It is caused by damage to the nerves, which messes with emotional expression.
Fascinating. And what are the early symptoms of PBA that could first raise concern about the condition?
Well, as Lola mentioned, inappropriate laughter or crying. Also, just emotional outbursts. Sometimes, rarely, there are also symptoms where your conveyed emotions does not match your facial expressions.
What an odd condition. How do you know if you have it? Are some people more susceptible than others?
Well, anyone can have PBA, and it's not more common in one person to the next. As for how you know if you have it, you have to get a neurological evaluation. There is no official test, but well-trained neurologists, such as myself, can diagnose it through tests including CNS-LS.
When should someone consider getting tested?
Well, people normally wait until symptoms linger for a few weeks, post-head trauma, before coming in. But we also suggest that before coming in for testing, patients try therapy or depression medications.
Let's welcome Lola back. Lola, when did you get in contact with Dr. Hummus to get help for Scarlett?
I first tried to talk it out with Scarlett, but she told me it was just a side effect of her depression, which she had been diagnosed with for 3 years now. It was on medication for. When she refused to bring it up to her therapist, I felt the need to call a doctor.
Why would she bring up her depression? What does that have to do with PBA?
Well, depression symptoms and PBA symptoms tend to go hand in hand, so they are very easy to mix up.
Actually, the first doctor we went to agreed with that it was just Scarlett's depression. But once we went to Dr. Hummus, she finally diagnosed her with it.
Oh, how fortunate. What would have happened if you hadn't diagnosed her?
Well, later symptoms are very similar to early ones, just more intense and frequent. People with the condition will often become socially isolated out of embarrassment, but by diagnosing her, we were able to assure that she would receive proper help.
That's good. Besides just resources, can PBA be cured?
Unfortunately, there is no cure for PBA, but it can be treated with brain medications such as antidepressants, which limit emotional outbursts. Since Scarlett is already on antidepressants, I've also been working with medical techniques for her.
Huh. Lola, could you go grab Scarlett for us? I'd like to speak with her.
Sure, I'll go get her.
Hey, while we wait, can you check out my gum for me? Is it infected?
I'm not a dentist, ma'am.
Oh. Ah, hello, you must be Scarlett.
Hi.
What's it like living with PBA?
Most of the time, it's like it's not even there. To be honest, I don't think it's that big of a deal.
Oh, that's great. So nothing will go wrong with your PBA?
No.
Well, actually, if not taken care of carefully, other things could go wrong, including nerve damage to the brain, life-changing injuries, and possibly death.
We'll be right back. All right, we're back.
If a patient gets treated, they can have almost full quality of life back, but it is important that they do get treated. As for those who do not get treated, they will have trouble functioning in society, but their health will not directly be affected, just more at risk of certain brain injuries.
That's all. We'll be back tomorrow night to talk about the squirrel takeover. PBA?
We messed that up. Or an underlying health condition,
I forgot what I was gonna say.
a brain tumor, or
Talk to Scarlet. He's concerned about the condition.
antidepressants.
I'm sorry. Yo!